Today we'll be discussing our research and analysis. We created a SNP genetic test for obsessive compulsive disorders in order to help patients fight and prepare. Obsessive compulsive disorder, or OCD, is a common disorder in which a person has repetitive and uncontrollable behaviors or thoughts that he or she feels the need to complete in order to relieve their feelings of anxiety. Some common compulsions may include hand washing and compulsive counting. Persons with OCD may also develop tics. OCD affects the brain and brain cells, specifically the prefrontal cortex. There are two genes that have SNPs that are associated with the trait OCD. They are named SLC6A4 and TPH2. There are also studies that prove the transthyretin TTR protein to show a significant decrease in expression changes with people with OCD. This protein has multiple functions, including that it is in charge of transporting vitamin A and a hormone called thyroxine throughout the human body, but it does not work properly in OCD patients. According to the medlineplus.gov entry, the frequency of OCD in the general population is 2%. The heritability or genetic risk for OCD is around 48%, meaning that half of the cause for OCD is genetic and half of the cause is environmental. In addition, the article states the inheritance pattern is uncertain, but there's a scientific evidence that proves the odds of OCD in case versus control relatives increase with the degree of genetic relatedness from 4.6 to 5.0 in first degree relatives.
As stated before, for our SNP chip test design, we're using two genes, SLC6A4 and TPH2. SLC6A4 has three genetic variations, CC, CT, and TT. CC and CT may be a part of the haplotype associated with OCD, but there is an unknown change in risk. TT is normal and unrelated to OCD. TPH2 has three genetic variations, GG, GT, and TT. GG leads to higher scores on anxiety-related tests and 1.5 times increased risk of OCD and related disorders. So this genotype is the most reliable predictor for OCD. GT and TT are normal and unrelated to OCD. We use the SNPs RS25532 and RS4570625. The RS25532 SNP impacts the SLC6A4 gene. The encoded protein for this gene is sodium-dependent serotonin reputake protein, which delivers the neurotransmitter serotonin and is located in the synaptic cleft. The RS4570625 SNP impacts the TP2 gene. The encoded protein for this gene is the tryptophan 5-hydroxylase 2, which catalyzes the first and rate-limiting step in the biosynthesis of serotonin and is expressed in the neurons of the brain. It makes sense that variations of the gene impact the risk of OCD because serotonin levels affect one's behavior, such as our mood and feelings of well-being. Thus, decreased serotonin levels could lead to mental health disorders like OCD.
There are many benefits to taking our SNP genetic test, including many scientific reasons. If you have symptoms of a disease that may be caused by genetic changes, have a family history of a genetic condition, are in an ethnic group that has a high risk of a specific genetic disorder, if you are a potential carrier, want to determine what medication and dosage will be most effective and beneficial for you, which is pharmacogenetics, are pregnant because tests can detect some types of abnormalities in your baby's genes, or if you desire a clear diagnosis to seek treatment. There's a lot of evidence supporting a connection between these variations we discussed and OCD, mainly in the form of research studies. One of the studies investigated the possible correlation of SLC6A4 polymorphisms in Iranian OCD patients, taking family history of psychiatric disorders and obsessive and compulsive subtypes and severities into account. The homozygous C allele carriers of SNP RS25532 showed significant association with OCD in men and were detected more in the patients who reported positive family history of psychiatric disorders. Essentially, if you have the specific RS25532 homozygous C allele genotype and the SLC6A4 gene, the risk of developing OCD increases drastically. This shows a clear connection between this variation and OCD. Another research study analyzed 2 common SNPs of TPH2 in a family-based sample of OCD patients who experienced their start of symptoms in childhood. The researchers found that the SNPs of TPH2 revealed a significant preferential transmission of haplotype G to C to children and adolescents with OCD. These also showed an increased risk of OCD for homozygous C allele carriers of the SNP RS4565946. It also shows a clear connection between this variation and OCD. Base risk for OCD is 2%, and a person's actual risk increases drastically if they have the variations I discussed. The homozygous C allele carriers of SNP RS25532 and SLC6A4, and in the SNP RS4565946 and TPH2.
Adversely, we must consider the limitations of our genetic tests. One scientific reason that you should not get a genetic test include inaccurate results that lead to unnecessary stress on test result recipients. In result, the stress can lead to additional health concerns such as high blood pressure. Inaccurate test results can also cause overdiagnosis, which can lead to overtreatment. Overtreatment can include unnecessary surgeries and procedures which carry their own health risks. Some tests may not detect all variations that influence a trait. Genetic tests also cannot account for large environmental influences that may influence how a trait is detected on these types of tests. Obsessive-compulsive disorder is a chronic disorder that affects and inhibits humans all across the globe on a daily basis. Most patients are diagnosed before they reach the age of 19, but diagnosis before age 35 can occur. It is often diagnosed and caught more early on in men than in women. Available treatments for OCD are psychotherapy and medication, including the fluoxetine substance, which alleviates depressive symptoms by significantly reducing impulsiveness in OCD patients. Still, having the disorder, no matter what, can bring on many day-to-day struggles. They must learn to seek help, make lifestyle changes, and even manage stress. Most people would want to get genetic testing to see if they have the gene for OCD so they can begin treatment, get effective help, and prepare for their future. Some patients may not want to get tested because it can be costly, especially if they do not have appropriate health insurance. In addition, because this is a sort of anxiety disorder, if they know that they have the disorder, it may bring more uneasiness. Most medical professionals express their concerns and explain the importance of getting tested in order for a person with potential OCD to reach their highest standard of living. Therefore, join OCD fighters and get tested. It could not only help save your life, but it could save the lives of generations to come. Here are our citations for our images, and our references for the research are on the script. Thank you.